Running any business is frustrating because the costs only go up, and the ability for you to do what you want to do involves doing a lot of juggling in different parts of your life to be able to, as they say, the swan looks very serene on the water, but underneath the water the legs are kicking. And that's exactly what happens. What the patients don't see is the fact that we turn up at the practice an hour and a half before the first patient is there, and we'll usually leave I'm usually at the practice well past 9 o'clock in the evenings, because there's a lot of paperwork to do, there's a lot of correspondence to do, there is a lot of planning to do, there's a lot of documentation, follow-up to do. So I take photographs of all my cases, and I go through each one at the end of the day, and I say, look, this is what I did, and I like that, I'm proud of that. Stuff I communicate to the laboratory so that they can get on with their work. But the most frustrating thing, I think, is when what we do is not understood or appreciated, either by colleagues or more often by patients. And I feel, and my experience is that the education level of our patients when it comes to dentistry in the UK is actually very low. They're not actually aware of what we do. We still have this old, lie back, drill your teeth, it's painful kind of image, and it's just not true. And we have such sophisticated technology and knowledge at the moment that when you try to convey what you feel is the best thing for the patient, and they are skeptical, and the skepticism usually arises from, first of all, looking at the cost of the treatment, and then saying, I don't understand what any of this means, so therefore it's expensive. And getting it across to the patient, the amount of time and effort and vigilance that's gone into advising them. Sometimes, they don't even bother responding after you've written a report to them. You spent 3-4 hours at a weekend telling them, the diagnosis and what's required. And some of them, they just don't even bother responding or even sort of saying thank you. So I think sometimes it can be a bit thankless when you've diligently done your job and it isn't acknowledged. I think that's the most frustrating part of it. Otherwise, it's a very rewarding job, and I think the people that do respond and the people that do appreciate us and at the end of treatment say to us, listen, I had no idea it was going to be, it was this complicated. I had no idea there was this much work involved. Now I understand. It's funny, nobody at the end of treatment says we're expensive. Nobody, because they understand what the skill set is that goes into it. So frustrations are relatively few, but it's around running a business and probably communicating with people who aren't necessarily on the same page as what we do. But we try to change that. We do try to educate patients, and even if they are initially skeptical, it's quite nice to see a good number of them a year or two later, they sort of shop around and they come back and realize that we've given them the best appraisal of their situation, and then they're more convinced. But I think that's the most frustrating thing, that the patients don't really quite understand what we do and why we do it.